So I would like to invite the clerk to take us through agenda item number 1, though I would propose that number 2 shall be self-introductions, because I see a big team here. Thank you very much. Mr. Clerk.
Chair, let's pray. Almighty God, who in your infinite wisdom and providential goodness have appointed the offices of leaders and parliaments for the welfare of society and the just government of humanity, we beseech you to look upon with your abundant favor these your servants, whom you have been pleased to call to the performance of such important trusts in this land. Let your blessing descend upon them here assembled, and grant that they may, as in your presence, treat and consider all matters that shall come under their deliberation in so just and faithful a manner as to promote your honor and glory, and to advance the good of those whose interests you have committed to their charge. Amen.
Thank you, Mr. Clerk. Can we start with self-introductions? Item number 2, we start with the extreme left. The gentleman with no tie, you introduce yourself. You know the masks don't allow us to see you properly, so you introduce yourself.
Thank you, Chair. I'm Serikali Joel, MP Ntwetwe, Chankwanzi District.
Thank you, Chair. Good morning, everybody. Samba Edward Ndaula is my name, MP Katikamo County, South Luero District. Thank you.
Good morning, everyone. My name is Josephine Vebuna, Bundibujo District.
Thank you, Chair. Good morning, everyone. I'm William Lubowa, Assistant Director, Parliamentary Budget Office. Thank you.
Good morning, everyone. Bwire Webby, the clerk to the Committee on Health. You're welcome.
Yes, Dr. Michael Kenya, the chair of the committee and MP Ukuya County. May I now invite the minister to take us through the introductions of the team.
Thank you so much, Mr. Chair. Mr. Chair, Nabanja Robina, the Minister of State Health General Duties. I request that everybody introduces herself.
My name is Diana Atwina, the Permanent Secretary, Minister of Health.
Good morning. I'm Richard Kavagambe, Assistant Commissioner, Minister of Health.
Good morning, Chair, Honorable Minister. Dr. Laro Charles, Director of Health Services in the Ministry of Health.
I'm Dr. Patrick Tsime, Commissioner, National Disease Control.
Morning, Honorable Chair and members. I am Patrick Okello, Commissioner, Human Resource Management.
Good morning, Honorable Chair, members. My name is Dr. Kwai Joseph,
with the completion of the introductions, I think we can proceed with agenda item number 3, which is a brief communication from the chair. Once again, good morning, and I'd like to welcome all of you to this morning's meeting, where we are supposed to be discussing the National Budget Framework paper. As you are aware, we are constrained by time. The committee last week managed to go through a few issues, and then they raised issues for response. I'm going to propose that for us to move forward smoothly, we shall briefly go through the responses. This is subject to discussion and debate. We go through the responses, and then also after the responses, we shall request the technical team to tell us what is new in the budget in response to adapting to COVID-19, and also what the president said a few days ago, about a week ago, about issues of enhancement of salaries, free health care, and I think that will take us through the issues which members have sent me here, which are issues of human resource, emergency medical services. You see here increment of the budget of national medical stores, and then issues of UBTS, and then Mulago Super Specialized Hospital and International Specialized Hospital Lubowa, and then there's something about COVID here which is not clear, but it shall be clarified. In summary, I think that will take us through. We had the technical team and the members present then read through a few issues and then raise the issues for response, which response I see there is a new one today. And then those few issues I've mentioned, and then we shall go to AOB and then we close. I don't know whether that is acceptable. The honorable member is present. Honorable Sevikal, you want to say something? No? Yes, Honorable Mbwai, you are most welcome. Allow me also to take this opportunity to congratulate the Honorable Minister present and also the Minister absent, the others absent upon their successful re-election and election into the 11th Parliament. And I think, should we proceed with that? So we shall first go through the responses and then other issues will come as we go, as I've highlighted. I hope everyone has a copy of the response. And then we see. Yes, because when we start with the other discussions, they will take us away from the main issues of the NBFP. The honorable member who has just come and introduce yourself, and then we proceed. After the introduction, the minister will take over.
Thank you, Chair. My name is Zimbwa, People's Choice, Kasambia County, Igara West.
That is the right introduction because you are still from Kasambia. So,
thank you so much, Chair. My name is Zimbwa. I represent people of Kasambia, Mubende,
in this meeting, you are representing Kasambia.
Yes. Then MP elect Igara West. Then I'm a member of this committee. Thank you.
Okay.
Thank you, Mr. Chairman. Mr. Chairman, I request that before that, Mr. Chairman, allow me also to congratulate you for being re-elected to be a member of the 11th Parliament, and also other colleagues present, Honorable Serikali, Honorable Mbwa, and my sister. And of course, we still have our brother and my son from Katikamu. Colleagues, I wanted to suggest that now that we have these responses with us, in the interest of time, of course the budget framework paper takes priority. Now that you have these responses with you, I would suggest that you go through them, since we have just handed them over today, and then we go directly to the budget framework paper. Mr. Chairman.
They want to talk about 014 mainly. Is that agreeable? We see no one is there. Silence shall mean consent. Yes, Honorable Sabika.
Thank you, Honorable Chair. As an individual, I would like to suggest that we go through these responses since I'm new. I do not know what transpired, and it seems it is the gist of the matter for the whole discussion. But I will see how we can move on. That's my prayer.
You switch on your microphone and we go to the Hansard.
Honorable Chair, I think we can go through it quickly so that we can get to a beginning point. I was also not around when they...
For orientation purposes. Okay, Honorable Minister, can we do a...
Okay. That notwithstanding, Mr. Chairman, can I now request my permanent secretary to lead us through this in a summary form?
Okay.
Thank you, Chair. I also want to take this opportunity to wish you Happy New Year and also welcome you back where you've been, and to congratulate you, Chair, for the victory. And just let me also say that this season has been quite tough for the sector, as you know, and we have had many challenges as we go along in our discussion. First, on the budget performance, our total budget was 1.27 trillion, and by end of December, we had absorbed 40%. The biggest unabsorbed money in these 2 quarters mainly were under development. You can see especially external funding, and where a biggest chunk of this money was supposed to be for construction. And unfortunately, we've taken 5 months waiting for no objection from the World Bank, and so we couldn't start. So that brought our performance a little low to 40%. But when you look at other like wage, we've gone up to, we have spent above 50%. And so we hope that once we get the approval, we will be able to expedite in these 2 quarters. We'll be able to expedite the absorption. But also, as you know, Chair, we had also the lockdown for some time, and that also impacted on our implementation, and that definitely affected also the absorption. When we go to the performance of the development budget for regional referral hospitals, I will ask my colleagues to submit to you the one annex that has the detail the funds available under development for regional referral hospital in every financial year was 17.2 billion. And the performance report on civil works at each regional referral hospital, and also the distribution per financial year is attached. So I request that that it is provided. The upgrade, when we go to UGIFT, the upgrade of Health Center 2s to Health Center 3s, for the financial year 18-19, we upgraded 124, and so far the facilities that have been handed over is 118. In financial year 19-20, we upgraded 64. 40 have been completed and handed over. For financial year 2020-21, we are expected to upgrade 62. We haven't completed any. The procurement has been completed by the districts. We hope that they will expedite in the remaining 6 months. They will be able to complete. The delays for, as you see, for example, in financial year 18-19 and also 19-20, the delays we saw were attributable to some of these local contractors did not have capacity to do different projects at the same time. But also, I think also at the district level, we saw some challenges of project management weaknesses, and that was attributable to low and also delayed disbursement of funds. But we hope that this time, by end of this financial year, we'll see more facilities, not just completed, but also functionally utilized. How much money has been earmarked towards equipping these facilities? The resources earmarked for equipment for the upgrade of facilities. Under AMCHIP, we secured 7.6 billion, and the equipment that is being procured is going to go to the first 124, but not all, because this is little money, but that's what we got at that time. We also secured 13.9 billion under UGIFT, which will be used to equip the remaining facilities out of 124. So we are seeing 64 and 62 facilities. If they are completed, we may not have the resources to equip. Therefore, that remains a gap on funding. But also we anticipate that if we are able to control COVID, part of the equipment, like the beds we bought for COVID, some of it could go to some of these facilities. Therefore, it will reduce on the gap, on the funding gap. 1.4 were expected also to provide budgetary performance, challenges and lessons learned under COVID response. Let me begin with the challenges that we encountered as a result of COVID-19 pandemic. We saw, as you know, Chair, we had challenges of cross-border movement of truck drivers and ensuring that we secure our country through all these porous borders, and that stretched us in terms of infrastructure to support our health workers at the borders, to put labs, to transport samples, and also the human resource. To secure, there are about 360 porous borders, but we were able to put, I think, up to 56 border points that were fully manned by our human resource. The gaps in the knowledge of the disease was also a big challenge, and it remains a big challenge because some people up to now do believe that this is a hoax, it's not real. But also the skill gap for our health workers, because this was a new disease and it was also posing directly threats to them, to our health workers. So that was a big challenge to, first of all, to talk to them, train them, and build confidence for them to go on and manage this life-threatening disease. The pandemic exerted pressure on already affected health system. For example, at the time of outbreak, there are some facilities still we didn't have enough bed capacity in our hospitals and intensive care beds. We had up to 137 in the country. And also, we didn't have matching the human resource in acute care to manage. And that created shortage of staff because the hospitals had to pull some staff from wherever they were and to bridge this gap in the shortest possible time. And that definitely affected service delivery for other ailments. There was also, to some extent, at the beginning, it disrupted our essential health services, especially at the time of lockdown, when we had to transport everybody to go to the hospital. I remember even patients of HIV to access their medicines, the TB, at the time of lockdown. But I'm glad that that was a short period and we were able to overcome that. Notwithstanding the impact of COVID on the economy of our country in terms of even resources, and also the tax base of our country was equally affected. We have also seen that when there was this COVID, because of panic and all sorts of information flying all over the place, and given the disease being new, there are so so drugs that were coming on market, everyone claiming to be, like it is a solution. We are seeing so many clinical trial publications. They are saying hydroxychloroquine is curing, this one is not. We have got a number of antivirals that were on the market. And so we had to manage so much information and so much misinformation. We are still having some facilities using remdesivir, which later now the information that is coming out that it is not really effective at all. But to some facilities they continue using it. We are working with our case management to continue to train our staff, especially in the private where this medicine is being rolled out to, and it's very expensive, yet it has not been effective. The poor risk perception and behavior change amongst the public and also our health workers to ensure that really they take their lives serious has been a challenge, but we continue working on communication. Infection control and prevention amongst our health workers. As you, Chair, you appreciate the challenges of PPEs and all other supplies that were used were very, very expensive, and they were being consumed left, right, center, and therefore posed a challenge to our health workers. The infrastructure in our facilities, we had to adjust because this was rapid. We had to adjust to accommodate, for example, where we can install ICU equipment. But as you know, a number of our hospitals, they did not have existing infrastructure for ICU. So even right now, most of our hospitals, where we had to improvise some structures to shift some patients, remodel a few. But really, I want to say that a number of our hospitals where we are keeping the ICU equipment is not the standard space for ICU. So this remains a big challenge, and we hope that we shall receive resources to remodel some of these facilities to ensure that we have adequate space for our ICU equipment. And also even some equipment is not yet installed because some of the buildings did not meet the standard to put, for example, those pendants are heavy, and the existing structures, they will tell you that the ceiling or some of those old structures, they will tell you if they put that thing would collapse. So some of those are still in the boxes, and we hope that we shall get resources to expand and to install. So our lessons learned, well, we continue learning, but as you know, this is a pandemic affecting the globe, and one strength that we drove or we sailed on as a country was the existing epidemic preparedness and response experience, and that helped us to institute the task force both at national and district, and now we want just to move from the district to also to the village, if we can institute community engagement teams. And we do believe that that is the way to go to deal with this pandemic. We also, as a country, it was a success. We have noted that early lockdown, early intervention, we also was effective in stopping early deaths. We could have lost many more, but that lockdown was very useful. It has also helped us to train our workforce in critical care. And we continue to train. As I talk, we have now trained 400 acute care nurses. And we are going to continue training to ensure that all our regional referral hospitals have the right team to deal with acute services, emergency services. It has also helped us to bridge the gap between the technical and the political leaders at all levels, since this epidemic did not only require the technical people, the medical, but we saw also all the leaders at all levels get involved, and that way it formed a stronger collaboration. The stigma was also a problem, I must say, and it continues to be a problem. As you may have maybe heard, some people even fall sick and stay in their homes and they don't come to hospital. By the time they come, it is very late to intervene, and some have ended up losing their lives or developed severe complications when they would have avoided. I can go on and on, but basically those are main points wanted to bring out. Then the measures that we put in place to mitigate. As I mentioned, we increased the intensive care beds from 137 to 273 to date. We created additional space of 1,500 temporary beds for management of mild and moderate cases, for example, in Mandela, but also the regional referral hospital. We ensured that we expand capacity by providing tented wards. The critical staff I'd mentioned earlier, we recruited additional 463 staff, and we shall continue recruiting because this number is not yet adequate. The Ministry has also provided guidelines and standard operating procedures, even not only for our facilities, but also in other sectors that needed our input. For example, Electoral Commission, we worked with the Electoral Commission to come up with SOPs. We worked with education to come up with SOPs for opening of schools, beginning with candidates, but now we are working with them also to ensure that we work on the SOPs for opening fully the hotels, markets, malls, and all other places that required opening up. But we continue also providing the SOPs whenever we are called upon by the task force. We also continue to develop simple messages to the communities at all levels for them to be aware of how we can prevent infections and manage the new normal. We created epidemiological buffer zones where surveillance, risk communication, reporting, and community engagement continue to be undertaken. The Ministry of Health also received a total of 18.3 billion for COVID activities for the period between July and December. Of this, 90.7 billion has so far been spent. The details of the budget and expenditure is attached in Annex 1D. Can my team distribute the details? So I can continue. Okay, if we go to 1.5 on staffing and remuneration levels at health facilities, we acknowledge the importance of having the right cadre and the numbers in our health facilities. And we have been engaging the relevant ministries, Ministry of Public Service and Ministry of Finance. The latest meeting was held on 30th of November, and the matter was exhaustively discussed. And the Ministry of Finance, Planning and Economic Development promised to identify funds to facilitate the absorption of the health workers, especially the one we have recruited at this time of COVID, because we know that they have gained a lot of experience and will need them moving forward, not just because of COVID, but also to strengthen other areas of service. So, in the interim, upon the expiry of 6 months and following clearance by Ministry of Public Service, all our contract staff, we had to extend for extra 6 months. Additionally, we had to hire 120 critical care staff from Mulago in December because of the numbers that were surging in Mulago for COVID. And these are people who we have trained and we continue to train. And therefore, we hope that this workforce should not be let to go after they complete their contractual term. We really pray that this committee helps us to advocate so that these staff are fully absorbed after their term has ended. And it's not only for Mulago, but even regional referral hospitals, because of now that we have expanded and put ICU services, we'll need staff there. And we have also attached the details showing the district staffing norms at national and regional referrals. Please, can you share that annex too? It's already there. Okay. So over the years, the health sector has faced challenges of wage absorption, and the committee wanted to know the update in as far as this problem is concerned. Our response is that in order to address challenges of wage absorption, we have actually actively engaged all stakeholders, including the national referral hospitals, regional referral hospitals, and local government, first of all, to make timely submission, to ensure that, and we set timelines so that by beginning of July, all submissions are done. Then we hope that the service commissions are able to expedite the recruitment. This will continue to work together with all stakeholders to ensure that this is realized and is adhered to. Also, the committee wanted to know what interagency plans are in place to ensure efficiency in the recruitment process to mitigate this challenge. As I mentioned earlier, we are engaging this, and we hope that also the committee will have the opportunity to engage the Service Commission to prioritize this. For us on our side, we committed that come 30th of June, all submissions, both at Regional Referral Hospital and National Referral Hospital, must be already with the Service Commission, so that really recruitment is done early, because that was the reason why we are seeing a lot of money going back without recruiting. Yet we badly need the services of these people. So the other thing was also to centrally advertise, to reduce the cost. In some districts, actually, they have asked us, and we have advertised for them centrally, and then they go ahead and recruit. We are also engaging Ministry of Local Government and Public Service to ensure that should they receive the request for clearance, especially public service, we receive that clearance expeditiously, so that the districts are able to recruit in time. One of the challenges we have had from the district service commissions, they have always said they don't sit because they lack allowances to call other people to shortlist and interview. So the local government has promised that they will prioritize this issue and make sure that it does not occur. We hope it will. Section 1.7, during its oversight duties while assessing the level of preparedness to manage COVID across the country, the committee established that in many health facilities, many health providers had not been paid. Our response is the ministry paid COVID-19 hardship allowance amounting to 6 billion for the period of July to December, leaving an outstanding balance of 3.4 billion. The said funds were paid to Mulago National Referral Hospital, Entebbe Hospital, 58 border points, Uganda Virus Research Institute, and CPHL, and the pillar teams. The ministry followed the circular provided by the Ministry of Public Service in the payment of allowance. And those that were not paid at the time, it was because of the budget shortage. Even to date, we still have budget shortage. But also we needed to discuss this at strategic level, how this can be sustained, whether this is really sustainable to continue paying allowance, because COVID is here. Now it's like any other disease, it's going to continue. So we needed really to be guided whether this government can sustain to continue paying allowance daily for everyone who is taking care of COVID patients. So as soon as we secure resources, we'll be able to clear all outstanding balances. The 2.1, the total wage budget under the health sector is projected to remain static. The committee would like to know whether there are no planned recruitment in 2021, 2022. As I mentioned earlier, we engaged Minister of Public Service and Minister of Finance, and we clearly stated that especially now that we have even additional burden, the additional wage is badly needed, and therefore we cannot continue operating at the current budget. We'll need additional funding, and Finance promised that they will be able to find us more resources to that, especially in line with enhancement plan. But also, the sector has recruitment plan. As I mentioned, the The ceiling has maintained the same amount of money. But we do believe with additional funding, we'll be able to take care of this gap. Section 2.2, despite the increasing challenges arising from COVID management, among others, the non-wage budget in most MDAs, apart from regional referral hospitals, is projected to remain static. What is the implication? The ceilings are provided by Minister of Finance. However, Minister of Health has indicated critical funding gaps in budget framework paper totaling to 243 billion in financial year 21-22, necessary for delivery of health outcome according to NDP 3. So this will continue to lobby to ensure that some of these funding gaps are looked into and more resources are obtained. 2.3, development budget under the Ministry of Health and UCI is projected to decline by 282.99 billion. This is majorly due to projected decline in external financing. The committee is interested in reasons behind observed decline. The response is that the above decline is mainly caused by exiting projects from PIP, namely Uganda Sanitation Fund, East African Public Health Laboratory and Network Project, Kayunga and Yumbe projects. In addition, the donor numbers have not yet been confirmed by Minister of Finance, and this will be done in the second budget call circular. 2.4, committees is also interested in knowing the extent to which government has provided for counterpart funding. The summary, we have put also the money that is required for the counterpart funding. For example, Italian support will need 8.5 billion. The rehabilitation and construction of general hospitals will need 6.2. Global Fund, 2.5 billion. Gavi, vaccines and health sector, 37. Now, this one is not, we have not involved here the other funds for the vaccine for COVID. This is completely, the funds for COVID is not indicated here. The next section, the 2.5, the committee is also interested in establishing the benefit or challenges that have come with a shift from sector-wide approach. Our response is that it is envisaged that the program-wide approach will provide the following benefits. 1, it will reduce implementation challenges resulting from uncoordinated planning and funding. 2, it will reduce duplication, redundancy, and wastage of resources. 3, it will reduce silo approach to implementation across stakeholders and programs. Number 4, it will align programs and enforce judicious use of resources. Number 5, it will align outcomes and outputs to report measurable results that later you can link them to National Development Plan. 2.6, the government has undertaken the attendant baseline studies upon which stated baseline outcome indicators have been premised. If yes, this should be shared with the committee. Are the outcome indicators presented for the next financial year and the medium term premised on the feasible budget constraint. A response, this reform is spearheaded by National Planning Authority and Minister of Finance. Minister of Health will therefore adjust the targets depending on the resources that will be available. Unfunded priorities. Our observation is that the sector outcome indicators will be adjusted. I think I think there is a mistake here. Our unfunded priorities, we have got a huge list of unfunded priorities. The table is there. I don't know whether I should go through it. It is a long one.
The table coming from last financial year, I think, which I think members have. So then it read the whole
so
of
that
it,
one we
especially
can
since you have
leave.
no response.
Then when we go to...
I think the concern was that this list was there, but also in the framework paper you have a new list.
Yes.
So the issue is, are these ones sorted or not sorted, or you have readjusted to think of other things?
I think we are going to just readjust because most of these have not been funded, and yet we have new ones, especially now at the time of COVID. From the time we had this epidemic, even more demands, more unfunded priorities have merged. So the list will be a little longer. We shall just consolidate. Do you have anything you want to say, Councillor John?
I think through PS, the list, you are right, is coming from this financial year. And for the next budget, we have a new list that does not necessarily bring these ones, all of them on board. As PS said, the fundamentals have changed. And therefore, priorities have also changed from what we have this year. And there are some funding gaps that have been closed by our partners, whereas some government of Uganda is putting in some resources. So we have reviewed the priorities, and that's what is appearing in the budget framework paper for next financial year.
For 4.1, the committee would like to have comparative assessment of budget framework paper allocation. So we have attached also the health vote specific budget requirement for financial year 21-22. We have attached entire list. I don't know whether we are not going to go through one by one. Then if we go to cross-cutting issue, in the submitted budget framework paper of financial year 2021-22, each vote under the sector was required to earmark some funds for COVID management within available resources. However, given that the resources in the current budget are inadequate, Ministry of Health has a projection of 6.607 billion for COVID interventions for a period of 6 months. The detailed allocations are attached on, and I think the annex has already been provided. On gender and equity compliance, the Secretariat for the Human Capital Development Program is Minister of Education and Sports, and all votes under Minister of Health submitted their budget framework paper to Minister of Education for consideration, which might have caused the delay. Nevertheless, the report from Equal Opportunity Commission is attached for ease of reference, indicating a score of 82% for the Human Capital Development Program. The summary is also attached. On issues of uniform, in the financial year 1920, 3 billion was appropriated for procurement of uniforms. The committee wanted to know the progress. Uniforms were procured and distributed across local governments. We have attached the distribution list. The procurement of uniforms for this financial year is ongoing. The only challenge we had towards the end of last financial year, the same supplier who was making uniforms is also one of those that were also contracted to do masks. So there was some delays in completion, but we want to say that task was done and the uniforms distributed all. Number 7, the committee wanted to know the plan for the establishment of the National Emergency System. Our response is that as part of the National Emergency System, government plans to set up call and dispatch centers at each of the 14 regional referral hospitals. Each region will receive a Type C ambulance. This is an advanced life support ambulance to cater for an estimated population of 2 million. Each health sub-district will be provided with a Type D ambulance. This is a basic ambulance which will be covering 100,000 people population. The emergency policy is at cabinet level. We do believe that once cabinet has passed this policy, it will be easier to have our implementation plan rolled out and even funded. The funding requirement for this intervention requires 68.2 billion to run an existing fleet of 350 ambulances. This will cover the staff, salaries, and other operational costs that include maintenance and fuel for the services. We have attached the details for your review. Thank you, Chair.
Thank you, Madam PS and Honorable Minister for that brief. So before we go to 014, can we get a few responses to this one? Yes, there is is it Kasambia or Igara? Yeah, that one.
No, Amuru, you extend, you have corona.
There used to be a lot of corona in Amuru.
I'm not comfortable.
In
PS, if you can restrain. Now, Chair, thank you so much, and PS, thank you so much for the responses. However, I have some inquiries. One, how I wish the PS can tell us how far they have gone with procurement of the masks, because I've not had that report, and when we are in villages, masks are not there, and we know we budgeted for the masks. So which percentage are we, and where are the masks? Where did they disappear from? Then she talked about procurement of I think ventilators. How they are using some ventilators, but I wanted to know. I remember some time back, Makerere had engaged itself in manufacturing. I don't know what the best term, producing ventilators, and we could see them. So how far are we using those ones? Are you procuring those ones maybe by Uganda, build Uganda, or it was to do with showbiz? Then, Madam PS, for us who are concerned with education, when you ask when are schools reopening, what we are told is that they got advice from Ministry of Health that schools should close. So, not until you advise them, they are still waiting. So now, I've gotten an opportunity, Madam PS. When should we expect schools to open now that maybe you've reached a certain level and you know how Corona is moving? Then you talked about vaccine. No, you did not mention anything to do with vaccines. When only you talked about the trials in Uganda. But now, when should we expect vaccines? How far have we gone? Are we only relying on China, UK? Are we going to see vaccine coming from Uganda? I remember even some time back, our speaker, they had invented something to, okay. Now, okay, then, so you can even update us since we are not all that. Then, who benefits from this COVID money or allowances? Because I've seen some health workers complaining, it's only those ones who are attached to COVID patients that are getting the money. But the question is, if you found in your report, if you found a hospital having a staff of 120 and allocated to each and every department, then you come and take 40. You leave the rest doing the work for others who have gone to other field. Now, when money comes, who benefits for this money? And I think it's Chair, for a meantime, I can be there, but I will return. Thank you.
Yes, the MP. No. Ladies first. The MP from Amuru had the hand first.
Thank you, Mr. Chairman. I'm Lucy Akelo, Woman Member of Parliament for Amuru District. My sincere apologies for coming in late. I'm actually driving in from Amuru, and this is how serious I take this committee. Yeah. Yes, I have. And Amuru is safe now. Mr. Chairman, I want to thank the PS and the minister and all the technical team from the Ministry of Health. I entered in when we were talking about COVID, and of course, as you know, when COVID started, Elegu and particularly Amuru was one of the worst hit, and I'm happy that with great work, at least we were able to do something. Madam PS, I want to draw your attention.
So are you appreciating the PS for doing good work with the ministry?
I am appreciating, but I'm also, you know, I was taught to start by appreciating the little and then bring the but later. Madam PS, in your presentation, you mentioned many interventions that were done. I want to start from the point where I think Honorable Mbwa left, and that is in regards to payment. The biggest challenges that we faced, even during campaigns, even when we interacted with people, the first question that would come to us, the volunteers that were recruited to help, they keep complaining that not even a token was given of appreciation to them. What happened? Because even when we ask the districts, they keep telling us, you know, we had limited resources, we couldn't facilitate these volunteers. And then two, at a Lego border post, I remember when the minister, Dr. Ching, visited, there was an agreement to construct at a Lego Health Center 3. And because, and I think because COVID helped to bring out some of the glaring issues at the border, because the whole border point didn't even have a health facility. It was agreed, land was earmarked, even the contractor went on the ground, but as I speak now, they just ended at visiting the site. No work has been done. So supposing we have another outbreak, what are we going to do? Are we still going to continue lamenting, and yet this is something that has already been identified? You know, by now I am sure that the health facility would be running. So I have a letter from my chairman actually reminding me in writing, and I will gladly hand over this letter to you for your urgent and quick attention.
Through the chair?
Yes, through the chair,
okay,
sir. My sincere apologies. So this is something which is very serious. You know how we struggled with the illegal border post, and I don't think we want a repeat of really what happened. And at an appropriate time, I think, Mr. Chairman, this letter contains a lot of issues about Amuru, including some of the upgrades.
Since it is from Amuru,
yes,
it needs sanitizing. You may go direct to the PS, but
I'm sure they have means of sanitizing it. So I have it here in my hand. So I will say
you have direct access there.
Pardon?
Yes, it is okay. Proceed.
Yes, and finally, Mr. Chairman, I am very concerned about the donations that were given for COVID, especially the vehicles. How were they allocated? You know, because we hear in the corridors some of these were now used for campaigns. Yes, I mean, just to allay my fears, I'm very much interested, because I remember in Amuru we really struggled with issues of vehicles, even just for surveillance. It was a tug of war to get the vehicles on the ground to help the health workers. So I'm very much interested in knowing how these vehicles were actually distributed, allocated, and who benefited from them. Thank you so much.
Honorable Dwetwe.
So at what point do I hand over the letter, Mr. Chairman?
Well, you are free to deliver the letter to...
After sanitizing.
No, I don't know, but it's not going through me now since it is coming from Amuru. But you can forward it to the PS, maybe through the commissioner infrastructure there. Yes, even the PS maybe. Hey, you know, he's going to come and pick it. He's going to come and pick it. Don't worry. Okay, can we proceed with the Twetwe, then we go to Katikam.
Thank you, Honorable Chair. My first question is about the Amuchi project. Because the first batch was like 120, there's facilities to be upgraded. And she's saying some were handed over. But when you look at the second batch, it is also a second handover. Can I know the logic behind to hand over the second batch when the first batch is not yet finished? Because I personally, from Chankwanzi, I have Chikolimbo and Mujunza, and all those facilities are not yet completed, yet they were in the first batch. I tried calling the engineer, but he was a bit puzzled. He didn't know what to do. My chairman, LC5.
Which engineer were you calling?
The one for Minister of Health.
Oh.
Yes.
Because
my chairman, LC5, they have written to the PS requesting for the completion, but up to now, these facilities are not yet completed. Can we know really if there are those that were completed in the second batch? Because I'm not yet sure how you can complete the second batch when the first batch is not yet completed. We need a detailed report about that. Two, when you look at the masks, for me, I'm again confused when you look at the the way this one was put up, procurement of masks budget is 45 billion. Expenditure is 44 billion, almost 45 because it is 44.9. But available funds is saying 27 billion, 27 million. It's like the entire country has masks. Yet in my district, there is not even a single mask that was distributed. Can we know really how many districts were covered? How many are remaining? And the reason is as why those ones are not yet covered, so that you get the full information. Because during my campaigns, my opponents were dwelling on that point, that the gentleman sits on health committee, they got money for masks, and now they sat on it. It's what they are using for campaigns. So it was almost killing my coming back. When you go to page 8, I can see you did a great work and you recruited 463 staff. And you are saying that the budget for wage should remain static. How can it remain static when you have removed the 463 staff? And I've seen some staff that were recruited on contract. Who does the recruitment? Is it Ministry of Health or the Commission? And who has the mandate to recruit the staff? Those are my questions. Thank you, Chair.
Yes, Honorable Katikam.
Thank you, Chair. Mine has already been said by my colleagues, Honorable Serikali, but maybe to put it more clear about masks. Because it seems the whole amount which was budgeted for, over 45 billion for the procurement of masks, was all released according to the expenditure here. How come that some areas didn't receive masks and yet all the money which was budgeted had been released according to the utilization of the 119 billion.3? How come? Was it an underestimation during the budgeting process of the procurement of masks? What happened? Because all the money was released, yet some areas don't have masks at all from government. What happened? Thank you, Chair.
Yes, in the absence of the minister who has gone out briefly, Madam PS, can you respond to? Yes.
Chair, I want to thank members for those questions. First, let us begin with the procurement of masks. The entire budget for the masks was 85 billion. So far, we have received, can you help me because I don't remember the detail. Okay, so far, the money released to us is 45 billion. But to give you more specific, let me just give you more specifics. We had targeted to buy 34 197 masks. And 34, 108, 197. And so far, we have procured 31,115,197. And we have distributed in 125 districts. Now, along the way, we were told also to buy for the students who are going back to school, and we bought 2 570,000 masks, and we distributed all in the schools of the finalists. So in total, so far, we have delivered masks worth 33,685,197. Now, I apologize that some districts could not get all in time before elections, and Chankwanzi was one of them. However, we delivered masks on 23rd of December. That's when we delivered the masks to the district for distribution. And so far, the district? Yes, for the whole district. So we don't know if the leaders maybe didn't distribute them in time. Maybe you'll find that by the time we went for voting, possibly they were still in their offices, but we delivered, let me give you an actual number. We delivered 224,285. Those are the masks we delivered in Chankwanzi on 23rd of December. We still have a challenge because we haven't covered 10 districts. And these districts where we have not delivered include Parisa, Iganga, Sironko, Butaleja, Amuria, Agago, Mayuge, Mbale, Kaliro, Bujiri, and Bududa. The rest of the districts we have distributed masks. We were delivering at the district, and the district leadership would sign for them, and then task the sub-county leadership also to come and pick according to the allocation. And the numbers were based on the estimates. You might find that maybe some people maybe missed because we didn't have actual, because we didn't have the current census. We just based on estimates that UBOS provided and the statistic we've been using to distribute mosquito nets. So some members could have missed, but that is the number. Now, we still, what I also wanted to say is that so far, 2.9 million masks for these 10 districts are yet to be delivered. The expected total delivery the completion, we had anticipated that by end of this January, but unfortunately, as I mentioned, the cash flow limited that completion because the suppliers at one time, they halted the process because they were not paid, and we still have a big amount of money that is not yet paid to them. Yet we are pushing to complete this exercise.
So does it mean on the 80-something billion budget, you received
45?
45.
Yes.
So most of the masks have been
delivered,
but with no payment yet.
Yes, we haven't paid the suppliers.
Is it clear there?
Honorable Chair.
Yes.
Mine, I've called the cow, and the cow has told me that they were delivered a day before voting for MPs.
Sure.
It's what she has told me.
That's why we
according to what we had, maybe our drivers first took off for Christmas and they never delivered in time. But according to our documents on our record, we sent off these things on 23rd. Someone must have gone for Christmas first.
Chair,
I apologize, Chair, for that.
So that is noted. They will do the auditing.
Chair, something small to do with masks. Could I get to know the cost of a mask?
Okay, the cost of a mask is 2,400 each mask. So once we receive the resources and we pay, maybe this remaining will be the suppliers will expedite the distribution. Now, the issue of ventilators. It is true that Makerere came up with innovation, and we referred them to Uganda National Bureau of Standards, because all the machines, before you use the machine on a person, it has to be tested through to make sure that it meets the standard. Those processes of accreditation and certification is a long process. I think that's where they are. But the ventilators we are using, we procured them as way back as July, and we got them from abroad. Now, the Minister of Education is working with the Minister of Health, especially the scientific committee, the scientific advisory committee, to look at all the risks in schools. They have come up with different SOPs, and they continue working with them. I do believe once they are completed, and today I think the cabinet is sitting also to discuss the same issue, and our teams are going to present. I think the common position on when the schools will open will be guided by the cabinet and also the task force. On the issues of vaccines, we have been working with the COVAX facility in Gavi that is coordinating all countries to access the vaccines. We have gone ahead to sign the agreement with COVAX and actually submitted our application, which was approved. Right now, COVAX is in final stages of discussion with the manufacturers. As a country, we chose to take AstraZeneca, the vaccine, because of reasons that were well known. One, on logistical issues and on cold chain management, because the other vaccines require ultra cold conditions, which we don't have here. But also the science of it. So we chose AstraZeneca based on the statistics and information that is available on all the options. We can't tell you when exactly, but COVAX, I will ask Drew Wali, who is coordinating that activity, to say something briefly. But we can't tell you when, but there are certain things that they had asked us to put in place. The first one was that the in-country mechanism to a process that is going to manage the whole information system. Because this is a new vaccine, we need to teach, we need to sensitize the public. Number two, we have to take responsibility. We have to take the liability of anything that takes place. If I immunize you and you collapse and die, they will not take the manufacturer to court. So you have to have a mechanism within the country to manage all that and demonstrate that you are prepared for that. So the COVAX wanted us that we confirm whether we would take also multiple suppliers. We said no, we cannot take indemnity for all manufacturers, we would go for one manufacturer. So, but we hope that by end of February, we'll have gotten more information, because I think they are finalizing, they're in the process of conclusion with the manufacturers. And this one is not only Uganda, they are negotiating on behalf of 90 countries that applied through this COVAX. We are going to buy these vaccines at the same price. So there's no those things of I saw in social media that Uganda is going to buy at $17, Kenya is buying at this. No, we are buying through COVAX. But we are covering only, they are covering 20% of the the population, because we are going to give the health workers and those that are more at risk in the first phase of 20% of the population that is going to receive the first batch of vaccine. The subsequent, the government is expected to mobilize resources, and therefore that is also our work, and our committee will hope that you help us on this one, because we need to mobilize resources for the rest of the population. But we believe that by end of February, we will have more concrete information, or maybe we'll start receiving. We're also working with the private sector to ensure that even later, it's not only just government to provide, but also the private sector, those that would like to buy for their corporate members can do so, but in a manner that is well controlled, so that we don't see a lot of exploitation of the public or bring in substandard products. So that's the process. Drew, do you want to say something in addition so that we can go to the next issue? No, but he has no for us. They were going to be, he was coughing. These days even sneezing is a problem.
Thank you, Chair. I just want to give an update to complement that the objective of this vaccination is, one, to reduce unnecessary deaths, development of severe forms of the disease, in order to decongest treatment centers and protecting the health sector from collapse, so that eventually society can be opened and the economy can be allowed to operate. So in this way, the pressure which is on vaccines, there's a global pressure. Production is limited and everybody needs the vaccines. So targeting is going to be key. In that respect, the vaccines stocks which come in the country will start with healthcare workers so that they can continue working and continue with other critical health services. These are going to be something close to 63,000 doses for the strength of our health system.
So the Ministry of Health is going to pay for them, or it's Gavi sponsoring?
This is the Gavi sponsored vaccines which will come. Actually, we'll go by which ones come first. If COVAX comes first, we'll use the one through Gavi. If the alternative route through government comes first, we will also use. But the starting point will be healthcare workers. Then we move for the elderly, and we conclude with people with comorbidities. So we aim to cover up to 60% of the population, because the vaccines are contraindicated in the age below 16, which forms about 43%. So the COVAX facility, as PS had already mentioned, will cover.
So by comorbidities, you mean that if I'm an MPI, or what does it mean?
Thank you,
Chair. Simplify for us.
Thank you, Chair. That's the advantage of having you as a chair. The comorbidities, these are people who have other underlying health conditions, maybe diabetes, high blood pressure, they're having chronic kidney or heart conditions and lung conditions. So there's an outline. People with those conditions tend to succumb to the disease and they will be prioritized for that matter. Thank you. Yes. Questions. Thank you. As you're bringing these vaccines, you've mentioned people who are most at risk, like the health workers. Now, what about the vendors? Are they not at risk? What about commercial sex workers? Because most at risk in this case of COVID, who are they? Even politicians, we are highly at risk because we are interacting with so many people. However, Mr. Chair, the police, however, Chair, the media, unlimited. Chair, my biggest concern is, can you give us an update? We are talking about now vaccines from Europe and what? How far is our Ugandan research? Why are you less interested? We've not had any information. It's only them to come to the media and they say we have reached here. So, Madam PS, with due respect, you inform us, how far have we gone? I would have appreciated benefiting from the one from Uganda.
Chair, thank you so much, Honorable, for that question. All innovations that are taking place under the presidential initiative is being coordinated by the Ministry of Science and Technology. But what I know that they were supposed to have started the clinical trial, to start the trial. I'm yet to get the update information, but for purposes of information of this meeting, I would follow up and get a report, which we will be able to share with the members here, so that you know what is taking. But the work has been going on, but it's not coordinated under us. It is being coordinated by other entities. On the allowances.
Excuse me, Butcher. Thank you so much. Doctor, I take you back a little bit. He mentioned something about the vaccine is contraindicated to the age below 16. Can we have an update of, so far, according to the admissions been getting throughout the whole of this COVID, do we have some numbers for that age? And in case they are there, now, the vaccine is contraindicated to that age. So do we leave these young ones to die? What do we do in that age?
Okay. I don't have the statistics. I don't know whether Alan or DG you have by age group, especially 16 and below, the numbers. Do you have any statistics here? We can get this information before we leave here. So can someone ask Chove to run that and provide us that information before we leave? And on the issue of allowance, when there was this COVID, when the COVID pandemic was declared, we had to seek guidance from public service how would manage the risk allowance, since the standing orders was not providing for that. And we were guided, but that we only provide allowances to people who are taking care of the COVID patients, because it was not sustainable to pay every health worker everywhere. And that's why we had to designate particular places in regional referral hospital and designated particular staff, and also even not only those who are taking care of patients, but also who are in the lab, who are handling the samples of COVID, those who are transporting the COVID patients like the ambulance staff, those who are doing surveillance, following up on contacts, those who are screening at the border points, those who are counseling. Even now, those people, when they fall sick, they go into severe depression. So we have also counselors who go and talk to these people. So all those are risk because they directly get involved in one or another in this risk. So those are the people we categorized, and there are some, and they were categorized in high risk, medium risk, and low risk. And they are paid according to that. But what we saw is that there was pressure from all over the country, especially the health workers, because they were saying, much as we are not treating the patients directly, but in our day-to-day work, we encounter, we interface with sick people whom even we don't know. Why also aren't we being paid? But it was very hard for us to pay everyone in the sector, and that's where the problem was. Now, the volunteers, it was actually a challenge, a big challenge, because I think many entities engaged volunteers. And you know, in public service, if you go ahead and pay a volunteer when you have not engaged them properly, you don't have appointment letter, that becomes a big query. People actually can say that you connived with some people, you paid to ghosts, or you paid, you know, something that is not real. So I think that's where the challenge in the districts, they are having challenges to pay. For us here in Ministry of Health, we had a number of volunteers who they engaged when there was an outbreak and people had to take people at the airport to screen all those people who are coming at the time when they were entering into lockdown. At the border points, we didn't have enough staff. We engaged volunteers. But we had to seek clearance from public service. And we got clearance much later that you engaged volunteers, but you cannot pay them until you get clearance from public service. Then we got clearance from public service, and we gave them even engagement letter that we are going to engage you as a volunteer, we are going to pay you per day this much, and that letter is the one that we used to pay. So I think in some districts, maybe they didn't do that, and so you find that some of those volunteers remained unpaid. But also I know that also districts didn't get enough resources to continue. They got some money, but at one time it stopped. And that remained a big challenge. We hope that they will, in the budget process, they will take care of that gap so that they are able to meet the unpaid, at least to get allowances to pay for those volunteers, because they work. Now, I have statistics here. But here this is death. It is not the ones who have been infected.
PS, that's indicating this because it's showing actually that the risk of, though the numbers can be higher on those who get COVID, but if you look at that, we have only had 2 days who are below what?
Okay,
below 20.
Out of 316, we have the people who have died under 19-year-old. We have only 2. The rest are in other age groups. So I think that's why we're saying it was not a big risk.
I want to propose that, we are supposed to report to Budget Committee, and the budget framework paper should be approved by Parliament on the 1st of February. So I want to propose that we schedule a COVID discussion, because I saw Amuru talked about the donations. We can't discuss all those vehicles here. There were many. There was a Porsche, there was everything. So that should come on another day. I want to propose that we abandon and we concentrate
Chair, maybe I can just answer
on the
quickly.
policy issues like the health facilities 124.
Yes.
Or is there a provision of first sorting that before you go to the next financial year instead of leaving them? Those ones.
Yes.
And then we leave, the COVID may not end now. Yes.
Something that came, I just wanted, because it may also affect the budget in one way or another, I could have come in late and missed, but my concern is there are these private hospitals. Let me just mention St. Mary's Hospital, Acho, that has been, I think, of late now doing treatment for COVID. Is there any arrangement with the ministry in supporting such facilities? Because now they have cordoned off a whole, I would say, a whole big building to take care of the COVID patients, and yeah. So for me, that's my concern, and I think it has an impact on the budget.
Yes,
if there's any partnership.
She's going to respond, though she mentioned that they are using expensive drugs to extort money.
Yes,
but she was polite. She didn't say
but Chair,
the whole story. Yes.
Still on Chair, you said we need to reserve some time for this
for COVID.
For COVID,
audit,
but
yes.
Now, since we are trying to look at the budget framework paper, there are some things we cannot skip. PS, can you help us? Can you help me understand? Some time back, I saw a minister who was, I think, Ruth Acheng, telling Ugandans how the VHTs, the queues, they had started piloting to pay them in Central because they were supposed to do.
So that is coming in the 014, which I said.
Okay. Okay.
Yes.
Then, Chair, compensation for health workers who have succumbed to COVID, is it also coming into 104? Or
that is under gender. Compensation is under gender.
Okay.
She will talk about that one. Okay. Can't come.
Thank you, Chair. Mine is still about the COVID-19 fund utilization of 119 billion. Some hospitals are still lacking some beds and some hospital beds and beddings, and yet 4 billion was budgeted for, but most of the money has not been utilized. Why? That's what I wanted to find out.
Chair, can I just conclude hers, then we can come to... so the Elegu border point, the budget was made. We went ahead and we did the prefabricated structures to take them there because it was urgent. Unfortunately, when the teams went there, we found squatters there. Up to now, they are still there. We cannot construct when we are there squatters. Number two, the place flooded. And when the engineers went there, they needed, I think, additional funding to first backfill. They gave us a flooding place. And so that is something that the district wanted to work together with our teams to sort. So if they can expedite that process of getting the squatters off the site, it will help us, because we are ready. We want to take the things, but we're held up. The vehicles, we have a list. We can give you a distribution list. But also we are in the process. Once we have the budget, the money that we go to the private sector donate. They donated, and they donated in line with buying more vehicles. But this money cannot be spent until it has gone through supplementary budget. And since it was a season of campaign, most people are not here, so the supplementary budget could not be completed. So once that is done, the vehicles will be procured and more cars will be available to the districts. Now, the health facilities that were upgraded under UGIFT program, you know, the districts are the ones that signed contracts with the contractors. They are the ones that are paying them. For us, we are just doing the coordination purpose and also going to on site to check that work has been done. The contract of Chankwanzi was a big headache. Actually, we have asked that they blacklist. We wrote to the districts where that contractor was more than Chankwanzi. I think he was constructing like in 6 districts. 6. And he failed to work until we pushed the district cow to ensure that they terminate. they terminate the contract. So I think they are in the process of getting someone to complete that work. So we need to, I think the engineers, you've taken note, we need to expedite that, to follow up. Unfortunately, we have limited say. When we come to the district, you advise, but the whole work, the contracting, the supervision is done by the districts. So that's where we are. But that contractor was a very bad contractor, and I don't know how he was selected.
Thank you, Chair. Was it different from Muvende? Because I remember the district chairperson, LC5, how he was complaining that these contractors were contracted centrally. So, is it different or? Thank you.
Maybe, engineer, can you say something quickly on the contracting? We run the advert centrally, but the districts came together and formed the evaluation committee and evaluated and contracted these people. So, George, please, can you say something?
Yeah, thank you, Chair and honorable members. Now, the method that was used for getting the contractors, the ministry prepares the drawings, the standard bidding document, you advertise, the bidding documents are sent to the local governments. The contractors pick these documents from the local governments. Now, in a lot, you have 4 districts with the 4 health facilities. So during the evaluation, one engineer or procurement officer from the ministry will sit in that lot with a district team and they evaluate together. Now, they sit with the places are selected. Like this year, they sat in Sironko, Shema, they sat in Lira, in Mityana. Now, once you've concluded the evaluation and due diligence, the report is sent back to the respective districts and they sign a contract with the contractor. Now, in one lot, you find there are 15 evaluators, but there's only one person from the ministry. So really, it can't be the ministry that has done it.
Point noted. Now there is the MP from Komi who is a guest to the committee. I think, yes, he wants to say something. Yes, Mr. Commissioner, your point has been noted. The dog has accepted.
Thank you, Mr. Chairman. Silas Augon is my name. I'm a visitor in the committee, allowed by law. And my concern straight away, Madam PS, one, I want to appreciate you. Among the permanent secretaries, you follow their word. At least I know you. You promised to be sending us messages on delivery of whatever medicine to a health facility. I keep on getting them. I appreciate. My concern, Kumi Health Center 4, as a theater, I put it in writing that we do not have equipment. It is not equipped up to now. For the last 10 years plus. Kumi has very poor people. My voters are very poor. They cannot afford these facilities which are private. Men have resorted to selling gardens in order to get money for paying for, I don't know how they call it, when a woman is pregnant and she cannot deliver directly. That one is called what? Cesarean. They pay over 700,000. They are crying every time they are calling me for support. Madam PS, as a member of parliament, let me go down and kneel before you. Can you do something for Kumi Health Center 4? The place is not complete. We are the people. You have the power to help us. You have the power as a team here. I should not be begging as a member of parliament. It is very, very serious. Kumi Health Center 4. The facility is standing up to now. It is not what? Equipped for the last 10 years. And yet we have funding from government. These are taxpayers. Number 2, by policy, every sub-county is entitled to Health Center 3. The Northern Division doesn't have a health facility. I would be happy to see it noted here. Northern Division Kumi Municipality is also going to get what? Health Center 3. Mr. Chairman, I'm your visitor. Finally, Aterai Health Center 3 was initiated under PRDP. There's a wall up to Ring Beam. It has also stalled there for the last 7 years also. Aterai. A-T-E-R-A-I. This is an issue. Madam Chair, we cannot be, Madam Pierce, we cannot be lifting the health center 2s to health center 3s when there are places which are crying with 0. I beg that you do something about this. I trust this team. May God help us. Thank you.
Okay.
Chair, Chair, we have taken note, and I want to tell you that Kumi is on our list. Once we get equipment, which is under procurement, Kumi will get, and it is a priority. You can trust us on that one. Please, Sengendo, take note. So and the other ones we shall sit in within our means, and we'll follow up, sir. Thank you.
If he gets one,
yes, we shall.
He will come back next year for the second one.
Mr. Chair, we are going to do that. So I think he asked who has the mandate to recruit, and I think maybe quickly it is the Health Service Commission. But at the time of COVID, the Health Service Commission had not been constituted yet because the term had expired, and we didn't have the commissioners there, so we had to do it at the Ministry of Health. But we have already submitted for re-evaluation and also and validation.
Honorable Chair, can I know who recruits the commissioners? Because if it tells me that they have no commissioners to recruit, yet it is the mandate.
They have been now appointed. Right now they are there. They sworn in, I think, in December.
So there was a period of about 3 months where the commission was not yet formally given instruments after it had been approved by Parliament. Then everyone disappeared for campaigns, but I think she says it was sorted in December. Yes. When the contract expired in June, we were nominated, and then the process took much longer. I think we leave COVID now. We go to 014. Yes, Mr. Alboa.
Chair, yes.
I think the staff was talking about were COVID staff. And that's a different budget. It is not the one we approved here. Maybe she'll clarify, but you've got his question that you recruited the COVID contract staff, but it is not reflected in the framework paper. Yes, Mr. Robo.
Thank you, Chair. I have 3 areas which I would request that the Ministry gives further clarification to the members. The first one is we are aware that the government adopted the National Development Plan 3, and that is our planning framework. So the budget is always assessed in connection to NDP. So when you look at page 15 of the issues response, that's page 15, table 6. That table, why the committee requested for it, it was after they realized that there are issues in the NDP 3. So if you look at that table, you will not see the problem. Table 6, are we there? The last column, it is showing us what government of Uganda resources would be providing towards the health sector MDAs. The first one is the ministry headquarters. So NDP says that Vote 014 must be getting 393.2 billion. That's very serious. And I want to believe that the sector participated in costing NDP. So if that's what the NDP is providing for Vote 014 and you are getting $1 trillion, so at parliament level, we would be advising that you should be getting 393. So what is the implication of this now? And there are several votes where the NDP cost is lower than even the underfunded level at the moment.
So that is question one.
That's the first question.
This.
We need to know the implication of that. The second one is the Annex 1D. Annex 1D, if you can access, it is about utilization of the 119 billion for COVID. So the issue is on number 1 and 2, the budget for contract staff salary and NSSF. So according to the statistics here, it is that we have so far paid 2.2 billion, and that is contract staff salary. The corresponding NSSF contribution is 13 million. So when you look at those figures, there is a problem. That means if we go by that, it means that the budget for NSSF is higher than expected, unless there is something you have not shared with the committee, which you should share.
The third one?
The third one, the committee had requested that you provide the benefits of shifting from a sector-wide approach to program-based approach, not the benefits of program budgeting. And what has been provided are the benefits from program-based budgeting. But we would like to know, previously you have been sitting as health sector and the stakeholders, then you deliberate on priorities of health. We are shifting from that. Now you are sitting with Ministry of Education, Ministry of Gender, Water and Sanitation. So what are the benefits of that arrangement compared to previous when you are sitting as health? That's what the committee is interested in. Thank you.
Chair, thank you so much for the questions. I think we apologize on that page 15 that instead of NDP 3 planned allocation, that is the gap, that is the difference between the two. I think it was a mistake, our team that were compiling. It's just a gap. It's not the one that we are going to correct that. But the second one, our accounts is not here. I think it is something that we are going to follow up and rectify. Maybe the Richard Kabagambe can do something.
The issue of the contract staff salaries, you can see it is 3.6 billion. And the NSSF mandatory contribution is usually 10% from government, then the staff pays 5%. So that's the 10%, which comes to 362 million shillings. Now we are saying out of that, we have paid 13 to the fund, and we remain with 348. So, and this report is as of March to June 2020. So from June, what you are seeing here, from June to December, more payments might have gone through. Yeah, and I'm also being told that mandatory we had to remove 362, but some of them had not yet completed the requirements of NSSF, like numbers, cards, etc. So that's why that money was not yet paid by then.
Thank you. That's what I wanted to clarify, that there is pending payments towards this already remitted.
Now, the issue of the program, the benefits, the program approach.
It was a new reform that actually had to be implemented as soon as NDP3 comes into existence. And we had a lot of interaction with Ministry of Education, NPA, Ministry of Finance. The same questions you're asking are the questions we put across. Nevertheless, as a reform to government, we looked at so many benefits since they are aligning the resources together. And we also of the view that wastage will be minimized if we go through that channel. And we had actually thought, if it was not COVID, to have an interaction between our committees. Like now, Education Committee sits their side, Social Services, we are seated here, but we need to have that interlink.
So we are going back to where we came from?
No. Just
yes, that is the implication.
To get the explanation, how are we going to be working together?
We initially had social services, which was covering all of those people who are here.
Yeah.
Now we separated.
Now we are going back.
Now we want to go back.
But there was also an issue of the law. Because as you were asking, how do you categorize? The law says maybe for equity and gender, each vote will be assessed separately. But right now we have been assessed as a whole program. So if you ask, what did the Minister of Health as vote 014 get in that assessment, NPA will not be able to tell, because we have been assessed as a program. So I think on that one we may have to have interactions with NPA to get an understanding of all this. But to us, we are convinced it's a good reform that we can opt at the moment.
Chair, I just want also to add, really this reform didn't originate from us.
It was imposed on you.
It was NPA and Finance, they came up with this idea. So maybe as we implement, that's when we shall be able to evaluate and know the real benefit. But for us now here as that is the area we don't have much
You are
information.
uncomfortable, but you have to proceed. That is what the team is saying. So, yes, Mr. Alboa, those things just not...
Yes, Chair. Chair, I understand. You see, this committee is just a part of health. So we want the sector really to progress. So given those challenges, you note that at the moment there is a finalization of program implementation action plans. These are supposed to pick from the NDP. The cost as well as the outcome indicators, which are already in the NDP. And this is next year will be the second year. So we are lagging, which means we may not achieve what we intend to achieve. And that has to be clear.
Yes, can we proceed? I think those issues, as we have discussed, should be captured in our report, and then we discuss as the whole House for the challenges to be understood. But we go to 014. Yes. 014, are you ready?
Well, yes, maybe. Mr. Chairman, I want to thank the committee members for the questions which have put us at a certain level in terms of knowledge. Vote 104, vote 014, Minister of Health, I will still request the Permanent Secretary, together with our technical staff, to make us go through this. Thank you so much.
I will also request Chair, if you are okay with it, Mr. Kabagambe can take us through this section. Thank you.
Okay, thank you, Chair and PS. We shared with the clerk the BFP for vote 014, and specifically I wanted us to look at what does it entail in terms of the vote overview. We started with the mission statement. We went to the strategic objectives, which are usually the same. And we had the overview table V1.1 of the snapshot of the medium-term budget allocations. We have a table there that shows the resource at the moment, 2020-21, and the medium-term expenditure projections. We have the wage of 14.6 billion, non-wage of 81.5, Government of Uganda development of 50.9, external financing of 1.124 trillion, and no appropriation in aid, giving us a total approved budget this financial of 1.271.70. So by close of December, we are showing what we spent Q1 as 133.07. Chair, as you can see, the projected MTF provisions are all constant. And for only wage and non-wage, we have got some deductions on external financing, and as we had already explained, this is because some of the projects are exiting the project investment plan. So that's what the table is showing, that our resource would be around 1.27, but nevertheless we also include, we'll be mindful that the second budget call circular will be coming out soon, and the numbers are likely to improve. Chair, the vote, the V2 shows the past vote performance and the medium plans, which are listed, the key performance for the previous financial 19-20, and they are listed. I don't know whether you want me to read through or I can go straight to others. Should I read? We are also showing the performance as of the BFP 2020-21 Q1, what we've done in the first quarter. It's also listed. We have also come up with the planned outputs for financial year 2021-22. They are also listed. We are also showing the medium-term plans. They are also listed. And we are also showing the efficiency measures that will be put in place during this budget process. Chair, from there we go specifically to the tables that shows our programs, intermediate outcomes, outcome indicators, and proposed budget allocations. And the first program we start with is the one of health governance and regulation. It is also indicating the intermediate outcome, sub-program objective, and the how we are linked to other sectors in terms of outcomes and intermediate outcomes. And it is also showing the intermediate indicators. And we are projecting up to the year 2025-26. So these are indicators, and our baseline was taken as 2019-2020. From there, we do the sub-program on health research institutions, which also shows the baseline and performance targets on page 6. Then the third sub-program we have is the public health services, and the indicators are also shown on page 7 and performance targets. We have also a sub-program on curative health services on page 8, and the performance targets and indicators are indicated on page 9. On page 10, we are showing the sub-program of policy planning and support services, showing the performance targets and indicators as well. Now, after that, we go into the figures now, showing what we are supposed to be allocating per output in each sub-program. If you look at the page 12, the health governance and regulation, the first sub-program we talked about, it has 4 outputs, and the budget allocations are indicated in the table V5.1 below. The sub-program of health research has 2 planned outputs, and the budgets, the allocations are also indicated. Chair, the new reform required us to show the budget requirements, the MTF allocated, and the funding gap. So each sub-program could sit with all the members, and if you look at the funding gap on the other side, in the last column, it is so significant compared to the budget provided. And it's based on this that government will see whether it's possible to make the gap narrow, such that we are able to attain the NDP3 targets. So the sub-program public health, the table is also indicated, and the allocations, it has 8. The one on human capital development has got 8, and the allocations are indicated. Those are planned outputs. Curative has planned outputs that are 21 number, and they are in the targets are also indicated, and money. Policy planning and support services has got 9 outputs, planned outputs, and the budgets, the planned budget requirements are also indicated. So we conclude by looking at the cross-cutting issues which we have listed from the gender, equity, HIV, environment, and there was also a requirement that we provide some resource and information on how we are going to mitigate the COVID-19 pandemic.
Yes, Mr. Kavagambe, through the Minister.
Yes.
I see in the issues response paper, for instance, on the last page, we are talking about the national emergency system and we require 68.2 billion. Now, when we go to the program of curative services and then we go, is it sub-program? And then we go to 17 national ambulance service. There is 7 billion, then there is a provision of 0.91, then there is a deficit of 6.1. Yet in the other document, we are talking about 68 billion. So I see the lip service does not tally with what is reflected in the NBFP.
The Chair, what you are saying is correct, but the submission.
So that one gives us a challenge already. And also, recently the President came out talking tough, very tough, and said now we want to go to free health care. I think because the PS had privatized the health care, now the President responded by saying free health care. But it is not reflected anywhere. What he said, even in the midterm, it is not reflected. Is it your problem? Is it a problem of Ministry of Finance? Is it a problem of Parliament? Is it a problem of the President? All those things we want to understand. And then we make our responses to this first call circular proper when we know where the challenges are.
Yeah, you are very right, but we need also to be cognizant that the required resource must be phased in a manner that is equitable and also sustainable. Because my brother here, I think if you are given 68 billion next financial year,
he's going to build the
you may not be able even to absorb half of it by end of the financial year.
Okay.
So the absorption issue must come in first, but also the capacity, because it's not about having regional hubs.
So does it mean that if we push, because there are many issues, if we push, if we get 7 billion, it would suffice for emergency medical services for the next financial year? That is yes. What we are looking at.
In a phased manner, I think it can, because already now we got new ambulances, we have the ambulances on the lake. So if we have that amount of money to operationalize the existing infrastructure as you prepare to recruit, because recruitment itself of the staff will take another 9 months. So we don't want also to have a resource that will...
Which you want to be able to use, yes. Or which will tempt you to... Okay, proceed, yes.
I understand.
And from that perspective.
So, Chair, I think with that, that covers vote 014. And in our narrative we indicated also the challenges and also the gaps, the critical funding gaps we have.
So can you take me through also the sub-programs considering the wage allocation as we've gone through, because now the sub-programs of health and governance, I want to know where wage is captured. And I see what changes and what are the funding gaps.
You see, like the wage is put in the sub-program where human resource, where the human resource department falls, because it was also our understanding. We used to have wage split in all departments. But we felt and we were guided that it is better.
A program?
Mr. Kero? Sub-program 12. No, this is human capital.
Which page? You know, these are new things, so we have to go slowly and understand them as a team and see how we